Good evening, croeso and welcome to Pilates for backs and beginners. And I've put the camera around this way because we're going to spend all the time on the mat. We're going to do the warm-up on the mat, we're going to do the workout on the mat, and then we're going to finish on the mat as well. So you're not going to be in a standing position at all. If you're somebody who finds getting up and down off the floor difficult, and it's one of my most popular blogs, then I will post a seated Pilates class onto the YouTube page so that you can have a go at that instead. For backs and cares and beginners, for me, this is a very technical way of learning about Pilates, and it requires you to be involved in the process. So you have to have a little bit of confidence to be able to listen to your body. And if I can remember to do this thing ever, it would be amazing. Here we go. So you need to listen to your body in terms of how it feels today, because if you've got a bad back, you can sometimes have good days and bad days, or whether whether you feel good today and you can do a little bit more. This is very gentle, it's very slow, it's very controlled. It gives you plenty of time to focus and to think about what you're doing. And you should be able to come back to this video time and time again. I often call Back Care Pilates or Beginners Pilates Groundhog Day, because you need to start learning those pathways. So yesterday we talked about dopamine and the way that we can shape our kind of journey with reward and recognition. And the reward you get from back care is that you feel immediately better. And I think you can't ask for any more than that. So from now until half an hour later, you will feel better. So if you are ready, you need to get yourselves comfortable. Can you see that stain on my mat? I do apologise. I've put all my mats are in the hall. And I've got a white unit here that I keep all my stuff on. And it was so hot, the white paint melted into my Pilates ball. So when I used it yesterday, it caused all kinds of issues. Okay, you have to excuse me crawling across the floor. All right. So we're going to use the ball and the band to help us do the exercises, but we're going to start in the lying position that we did yesterday. Now, when we're doing the lying position, this is something we need to practice, because lots of people can't sleep well at night because their backs are aching, or they feel like they've got to have 20 pillows around them. And this is about getting in tune with your body to see how it feels. Like all Pilates principles, I want you to lie down quietly for around 30 seconds to a minute to let your back settle into position. You might be like me, you might need a pillow behind your head. You might find you want a pillow underneath your lower back. You might want to keep your socks on. You really need to kind of get into the comfortable place before we start. So we're going to do the breathing we talked about. So thumbs are together, and you're going to place your thumbs across your belly button, the fingertips down towards the front of the hips. You're going to take a deep breath in. Fill your stomach with air, and then breath out and allow your hands to sink down. Feel that relaxation on the inside of your body. So think about the inside of your back having the relaxation. And again, deep breath in, lift the elbows up, breath out, and as you breathe out, let the elbows drop down slowly. And again, deep breath in, elbows lift, and slow breath out. From there, take the arms out wide and in line with your shoulders, and you're going to step your feet out wider than hip distance apart. You're going to move the legs asymmetrically, okay, so they don't stay together. I want you to focus on the movement of the thigh bone into that hip socket. So as you're doing this, keep the movement very specific to this area. As you get more flexible, you might find you can come all the way across with this foot near the knee, like in the mermaid position. Okay, keeping it nice and gentle. Okay, you're going to take underneath your right knee, you're going to take a deep breath in. As you breathe out, you're going to pull your knee towards your body and feel your lower back having a stretch along the floor. If you feel comfortable, straighten the other leg out like we did before and push your heel away. place your right foot down and we start on the left. So hold, take a deep breath in, breath out, push the leg away. Try and get your calf on the floor and push your heel away, let the hip open, and then relax. Okay, bring your feet together and your knees together, and hold your hands and keep them up. So you're going to keep your line of vision with your hands are going to stay in the same place, and you're going to move your knees together from side to side. As you're doing that, feel this part of your back pressing into the mat, just having a little bit of release and stretch. You don't want to come all the way over with the knees apart on this one. The minute you feel your knees starting coming apart, bring them back together and then go over to the other side. If you're flexible, you might find you can roll the whole way, but you keep looking up at the hands. Don't worry if the knees come apart when you come back up. And then go into your frog stretch and take the arms above your head. You don't want to let your back arch too much. You want to feel like you're stretching through the front of the pelvis here and across the inner thigh. Bringing the legs in together and taking your feet hip distance apart. Lift and lower your toes a couple of times. Take your arms up in line with your shoulder. Extend the fingers up towards the ceiling and drop the shoulders down. These are called toe soldier arms. So you reach back and down. Now if you've got any shoulder injuries, remember, take it easy on this. You want to feel the movement in the shoulder joint here. Yeah? You don't want to feel your ribs lifting up and down. So if when your arm comes back, your ribs and your back start lifting up, bring your arm back down to me. Then bring your arms around your body. Sorry, my son was phoning me. Here we go, let's try that one more time. And then release. Okay, so we're going to slide your leg along the floor and it's just going to hover and you're going to bring it back up. Now you notice your hands are on your pelvis. You're trying to keep your hands steady and still. So as you're doing this, so the pelvis isn't rocking forwards, you can keep the pelvis into position. Do 2 more of these for me. And this time, breathe out and try and tighten your stomach muscles as you do that movement. And again, one more time. And then release. Okay, feet are down onto the floor and we're going to come up into a bridge. So you're going to use your hands to help balance and you're going to hollow your stomach. So I always talk about this being like a big, massive Yorkshire pudding. Okay, and that's the Yorkshire pudding bit that you're going to fill with gravy. So kind of hollow it in and then push and lift your hips up. Now keep your chin tucked in and stretch your fingertips towards your ankles. Keep lifting as high as comfortable till you feel your butt muscles working and then lower down in 1 unit. And what I mean by that is I want you to imagine that you have, that everything here is very stiff and you're going to lower up and down using the hips. If you find having your hands on your hips works, you can push forward here, lift up and down, and again one more time, lift up and down. Okay, so you're going to take the arms to the side and take the knees to the other side. And then you're going to change over. So for this one, because the back is a little bit warmer, you might find that you can move a little bit easier. If you're used to doing this, breathe out as you move across. Okay, so we're going to get the Pilates ball now and you're going to place it between the kneecaps. You're going to step the feet in close. You're going to pressurise the ball to engage the pelvic floor. As you pressurise the ball, you want to hollow your stomach. So think about drawing your stomach muscles together and then you're going to push and lift, keeping the ball in place and reaching your fingertips down, chin tucked in, and then release down. We're going to do 4 of these. Now, if you have your hips only a little way up, your back muscles don't do much work. So you want to encourage that. So you can keep your hands underneath your back if you want to. Or as you get better, keep your hands there and then try and lift your hips off your hands, and then have the support of the hands on the way down. Try it one more time. Squeeze the ball, and then release. Roll to me, knees together. And this time, when we do the bridge, we're going to pump the ball, okay, a couple of times. So coming back to the centre, feet are in. You're going to take a deep breath in. As you breathe out, hollow the stomach, push the ball in and tighten, bring the tailbone forwards. You're going to push up and lift, hips higher than your pelvis, and you're going to press the ball in 4 times. So you're going to go 1, 2, 3, 4, and then you're going to roll down. I'm going to do that one more time. Lift up. Ball's going to go 1, 2, 3, and squeeze. You should feel that working. And then you're going to roll down. And you're going to take that ball away. You're going to take the ball out to the side, and you're going to look at the ball. Then you're going to lift up and swap the ball and look at the ball as it goes over. Coming up. Keep your eye on that ball as it moves. Lovely. One more time. And then release. Okay, so you're going to stay with your knees in this position. And you're going to come over onto your side here. You're going to use the ball underneath your head to support the weight of your head. And we're going to do the clam again. So knees are in line with your hips. Feet are together and tucked in. And you're going to push up and down. You're going to have the hand on the floor in front, lift up and down. Good work, stay with me. One more time, and then release. Taking the ball, and you're going to hold the ball in this hand. This arm's going to come along the floor, and what you're going to do is you're going to do that movement we just practiced, but you're going to keep the knees in that still position. And then you're going to bring the ball back over. Now, if you can, follow the ball with your head. Okay, and then follow it back round. And then again, one more time, follow the ball over. So you can get the ball to touch the floor. Now, if that's comfortable on your shoulder, you can keep doing that. If you want more stretch, we're going to do ball up. And then you're going to try and reach that spot we just went to. Then you're going to come over the hip and here. So it comes up, opens out, all the way around and in. And we've got one more time. Lift, lift, lift. And then release. Coming back to the centre, bring the knees back up, tucking your chin in. You're going to have the ball, and you're going to use the palms of your hands to push the ball in. You're going to take a deep breath in, breath out, tighten your stomach muscles and compress the ball and lift your right foot 1 centimetre off the floor. Push your leg away, straight leg like we practiced before, and then bring it back in, place it down and release the tension on the ball. Don't hold your breath. So you want to go breath in, breath out. Push and squeeze the ball, tighten your stomach muscles, keep the tension on the ball, keep your breathing light and even, push the leg away, bring the leg back in. As it comes down, release the tension on the ball. So I want you to imagine that as you're squeezing the ball, you're squeezing through the lower abs, and if you can, tighten the pelvic floor. If your shoulders feel okay, you're going to keep the elbows slightly bent and take the ball behind your head, but there's no movement here. So where this part of your rib cage is, and this bit of your body, you don't want it to come away from the floor so that you can get a gap. There's a gap there. You keep the gap closed. You don't necessarily want to force your back into the mat, okay? So you just want to maintain contact. If you don't want to do it, just do the leg movement. So you take a deep breath in, breath out, squeeze and tighten, lift your foot. So as the leg goes away, the ball comes back behind you, keeping your body really long. Breath out, bringing the ball back in, placing the foot down, releasing the tension. Breath in, breath out, squeeze and lift. Keeping your tight elbows in together, keeping your rib cage down flat, keeping that core control. Breathe out and release down. Going to try it again. Deep breath in, squeeze and press. Push that leg away. Now stay there. Pump the ball 2 or 3 times, squeezing your elbows together, and then breathing out and coming in and down. Release the tension. Last one. Breath in, hold the position, pump the ball. So even if you've got the ball here, pump the ball 2 or 3 times, and then breathe it out and come down. So we're going to take the ball this side now, and we're going to drop the knees this way. We're going to do this movement again here, so you can see it from a different angle. So you turn onto your side and you follow the ball the whole way around. So you don't want to move the arm too quickly, and you try and keep your knees on the floor. So you turn your head as well, and then turn and see if you can get your shoulders down. If you've got shoulder issues and you want to stay there, that's fine. Now we're going to do the other one. So you start here, you take the arm up, and then all the way around to that point, all the way over the hip and around. So think of like a clock face, and the movement is touching all the numbers on the clock face. One more time. Lift, lift, lift. And then release. Bring the ball back up towards the centre, and we're going to come up to sit-in. So to come up to sit-in, you can roll over onto your side and press, and we're going to move across to the other side here. Okay, so we're going to do the clam in this position. So when you're lying down, you can use the ball here to support the weight of your head, keeping the hips stacked, remember, and tucking your feet underneath. Push up and lift. We're not too many, so we're just going to work through that hip just a little bit. Lovely. And again, lift and push. Let's just do one more. Lift and push. Okay. So this time, you're going to straighten this arm out along the mat here, and you're going to reach this arm up. It's going to tap the hand, or if you've got bad shoulder, it's going to tap the floor here. And then you're going to tap and straighten your leg. You're going to bring the knee in and tap. You're going to straighten the leg, keeping the hip level, and down. If you feel you could do more work, you can come up onto your elbow and then down and rest. If you think you can do more work again, do this with straight legs. So lift the leg and bring the knee in. Lift the leg and bring the knee in. One more time. Lift the leg and bring the knee in. So from here, we're going to do the other leg after. We're going to come up onto your hands and knees. In this position, we're going to do the cat and camel. So you're going to tuck the tailbone underneath, arch your back, and then release and lift your head. You're going to sit your hips back and reach your arms out, elbows down, head down. You're going to come back up, and we're going to do it one more time. So tuck, tuck, tuck. Release. Push your hips back. Reach your arms out, head tucked in and down. Okay, so this exercise is called single leg stretch, and it's all about balance and working your body. So spread your fingers wide, check your arms are directly beneath your shoulders and that the inside of your elbows face towards each other and not turned out. Take a breath in As you breathe out, hold your stomach muscles in and look back and check your knees are hip distance apart and the hip to the knee is in a straight line and they're not tucked under. Lift your right hand 1 centimetre off the floor, then your left knee 1 centimetre off the floor and hold that position as still as you can and then place it down. Take a breath in. Breathe out, hold and lift your stomach muscles. Lift your left hand 1 centimetre, then your right knee. Now be careful your head's not dropping down. Keep the back of the neck up towards the ceiling and then release down. Reach your hands forward, and in order to help arthritis, in the child's pose, wash your hands or open and close your hands or move your fingers to keep that blood flow. Okay. Getting the ball and placing it between the knees. Tucking your toes underneath. You take a deep breath in. As you breathe out, hold your stomach muscles in, lift your knees and squeeze the ball and then release down. I want you to watch me first because I see people doing this wrong, and all you want to do is to lift your knees that 1 centimetre we practiced, but not lift your bum, okay? So as soon as you see daylight underneath your knees, you're going to stop. So you're going to take a deep breath in, breath out, hold, and then lift. Hold it there, and then release down. We've got one more to go. Deep breath in. Breath out, squeeze and lift. And then release. Okay, sit back and ease out. Now we're going to get the ball and you're going to place it here on top of your hip. Okay? You're going to lie on that ball, right on your hip, or your cushion, whatever you've got, and you're going to take the other leg out to the side like this. And you're just going to lift your leg off the floor and move into that hip area. Feeling that stretch through the front of the pelvis, and then release. Up you come, place the ball under your hip, other leg out to the side, and then just move into position. Lovely. And then release. Take the ball away and come and lie back onto the side we started at. All right, so lying down, knees are bent, and your arm is on the floor. Your ear needs to be on your arm. Now, if you find that uncomfortable, you can, change sides too many times today, haven't I? You can put your pillow in between your head and your arm if you find that easier. This ball, when it comes up to the ceiling, you want to squeeze it. So it's going to tap, and you're just going to tap your leg, and you're going to push your leg away. Yeah, so you're going to tap the hand, and you're going to tap the leg. And as you reach towards the leg, squeeze the ball and pull your shoulder away from your ear. Now, if you want to make this a bit more challenging, as you bring that ball up, just lift up onto your elbows if you're trying to get out of bed, and then take it in and down. Breathe out and squeeze, and then release. And then if you want to make it harder again, your legs are straight as you do this movement. Lovely. And again, here we go. Up and up. Well done, everybody. Let's just do one more. Good work. Okay. From here, you're going to bend your bottom leg, and you're going to hold the front of your shin, and you're going to pull this leg back. Now, don't have your shoulder forward. Roll it behind you. Push your hip forward, and if you want to, you can extend that bottom leg along the floor. Take a breath in as you breathe out. Pull the leg back until you feel the stretch here through the front of the thigh and maybe across the top of the hip. From this position, bring your knee in front of your body, and try and look up towards the ceiling. Feel that stretch in the outer part of the hip. I'm going to do this stretch on the other side with my back to you, okay? So try and listen, or if you want to, just have a look at the different angle. I always think it's worthwhile showing here because I see a lot of people leaning back. Now, if you're leaning back, it's really hard to do this stretch. So you want to make sure you're really lying on your side. And secondly, try not to hold your foot if you can. Try and hold onto your leg and then pull the leg back and push the hip forward. Can you see how my spine stays in a good long position and I'm having a good stretch onto that leg? And then in this one, where your hand is here, you want to look towards the ceiling and then just start to let this shoulder drop down towards the floor. This is the area you should be feeling the stretch, yeah? Here. And then release. Okay, coming back to the center. We're going to do the movement that we started with, which is the deep breathing. We're going to do 4 cycles of this and we're going to take our time. So I want you to close your eyes, take a deep breath in and then a slow breath out. And feel that you are stretching on the inside of the back. So think about all the muscles and ligaments and tendons that are supporting your pelvis and your spine. Feel like you're releasing them down. And then again, one more time, deep breath in and slow breath out. Got 2 more goes, deep breath in and slow breath out. One more time and then release. So we're going to straighten out one leg. You're going to stretch out the opposite arm. If you can, try and keep your back fairly close to the mat. And then you're going to change sides. So single leg stretch, opening up through the hip. Breathing out. 2 more goes. Lovely. One more time now. And then if you feel okay, this is called pencil stretch. And for this, you can have a little bit of a lift. You don't want to force the back, but you don't really want to force it down either. Then come into your starfish. Now your arms come out wide and you want to rock and roll your pelvis. Bring the heels towards your body. Place your hands onto the inner part of your thigh and feel that stretch. And then finally, we're going to do a hamstring stretch. You're going to get your band and you're going to place it underneath the arch of your foot and let your leg bounce happily. Now you're going to take the band together, okay? So you don't want your band down here. You want to hold it high and pull your shoulders down. Slide the other leg away. Take a deep breath in. Breathe out, see if you can bring your leg any closer. Now allow the leg to fall, but watch you keep your shoulder down, okay? So you don't want to do this parting of the mat. You want to keep in contact with the mat and then bring the leg over and allow the stretch to come this way. Come back to the center, open the band, place the other foot inside and place that leg down. Let it bounce, okay? So you just want to let it relax. Walk your hands up the band, shoulders are down. You will be feeling the stretch here. So your legs shouldn't be shaking and I don't want to see your knee bent. So if your knee's bent, ease it out. If you want to, you can warm up the back of your leg. You can stroke that muscle and help it to relax. And then move into the stretch position. Taking the arm out to the side. And then bringing it back over and to this side. Okay, coming back to the centre, taking the band off your foot. And we're just going to do the movement feet wide and rolling through the hips. As you're doing that, notice a little bit more freedom of movement through the hips and the pelvis. Everything we've done works around this lower area. We have done some work on the shoulders, and mainly we've been doing the breathing work. Last set of breath. Breath in, breath out and release. And then again one more time, and then release. If you want to, you can stay on the floor there and just allow that stretch and relaxation to happen so that you enjoy it. When you do come off the floor, come up slowly and in a way that's appropriate for you. You can use a chair to help you get up off the floor. You can do modified roll-ups, but you don't want to rush out of a lying position into standing too quickly. That kind of exercise you can repeat often to encourage your body to move around. And I know I was changing from one side to the other, but this is part of the training. So part of the training is to look at functional movement where you have to get up off the floor and move from one position to the next. So even if it feels a little bit uncomfortable and awkward to begin with, you'll soon find that your body gets a little bit more used to it. I hope you enjoyed that session, and if you're doing the next session with me, I'll see you soon. Hwyl fawr. Hang on, I've got to crawl across the floor here now and switch off. Hwyl fawr.